most famous physical therapist on the internet.
Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical
Together
therapist.
we have the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Caught me off guard there a little bit. Today we're going to talk about 3 tips for knee cartilage problems, how to fix without surgery. Plus, we're doing a giveaway, Brad.
That's right, Bob.
So if you are new to our channel, please take a second to subscribe to us. We provide videos how to stay healthy, fit, pain-free, and we upload every day.
Every day.
Also, go to bobandbrad.com, go to the giveaway section.
Bob and Brad.
And this week, we're giving away a Fit Glide. We're going to show this throughout the video. You're going to like this.
Fit Glide.
Yeah, we invented this, by the way, and it's the cousin to the knee glide.
That's right.
So you can also find the contest on Facebook. It'll be pinned to the top of the page. Go to Twitter or Instagram or TikTok if you want a 60-second version of our program. So first, let's get down to business here, Brad. According to guidelines, and I think this was out of Australia.
Okay.
A bunch of surgeons that got together, and surgery, overall, I see this as kind of worldwide now. Surgery is not recommended on cartilage problems, even tears, unless you have locking of the knee.
In other words, it locks up. It's typically painful, right, and you can kind of work it, and it loosens up. You know, oftentimes a meniscus issue, but definitely the cartilage.
Well, you've always heard before, and years ago, someone would tear their meniscus, tear their cartilage, and they go, "Well, I got to have surgery."
Mm-hmm.
I mean, I tore it.
Right.
But what they're finding now, that those who had the surgery and those that don't, the outcome ends up being the same.
Sure.
In a few months later, anyway.
Right.
So
if it doesn't lock.
If it doesn't lock,
right,
if it's locked, that means that the cartilage probably folded up on itself, and it's going to just get worse. And they need to go in and have it done.
And it's really not a major surgery. They do them fairly.
Right, but it's surgery nonetheless.
Right.
And if you're not going to get much benefit from it, why do it?
Right.
So don't listen to us on this. Get a second opinion. If someone's saying, you tore your cartilage and they're telling you, well, you should have surgery, and it's not locking, I'd always get that second opinion.
Right.
So, all right, we're going to give you 3 tips, though, if you have a knee cartilage problem. The first thing is, if able, you want to get it to calm down. Knee pain, knee cartilage, it tends to flare up and it tends to calm down. A lot of times people go, "Oh God, it's bad and it's going to get worse." Not necessarily. It can calm down. So you can take an anti-inflammatory. You want to check with your doctor on that.
Sure.
You can also decrease weight on it for a while.
Right. In other words, you may want to use a cane, although a lot of people, I don't want to use a cane.
Right.
But it's not a long-term thing. It's just until it calms down again. The pressure of your body can, irritate it and continue to irritate it. So if my left knee is the problem knee, you're going to use the cane actually in the opposite hand. It's going to take pressure off. And so when that left foot goes forward, the cane goes with it. And now I'm putting pressure on my body, weight through my body is going through the cane, much less is going through that knee. And you'll find it. I've had patients that say, try the cane once and see how it goes, and I'll show them how to use it. And, it'll take a few steps, and they say, oh, wow, that does help.
I've found a lot of patients, Brad, that I think that alone helped calm it down.
Sure.
It just, and, if you can get past, well, a lot of people say, well, I'm not going to use a cane. I'm going to look old. So instead, what they do, they limp along like this, and believe me, you look old already when that's happening. Yeah. So you can use, if you're a younger person, you can use a walking stick. That's what my wife did. She had a flare up of her cartilage.
I thought she used a crutch.
She used a crutch too, but we also, when we went on vacation, she used a walking stick.
Sure.
And that she could fold way up.
Yeah, convenient for travel.
But you're right. She used a crutch or crutches, or even if if you are more elderly, you can use a walker.
And her knee actually improved to the point she's back to running.
She's back to running.
Yeah.
So it shows you these are not irreversible.
Right.
So the other thing is you want to avoid stairs and hills right now.
Yep.
Not to say forever.
And if you do upstairs, you go one step at a time
to protect the one knee.
Right. And you'll know which leg that goes up first because it feels better.
Don't stand with your knees locked. Well, watch this. I'm locking my knees. My pants are dirty.
Oh.
I'm going to lock my knees. Or don't stand putting all your weight on one side. A lot of people holding a baby will do that. They put it on their hip, right?
Or,
This hip?
some people will do that just out of habit, maybe from
Right.
having a baby years ago, and it just became a habit, and they have no idea. But then they realize, after we show you, it's like, oh,
Yeah,
maybe I do that.
It's funny, those habits, after a while they become like chains of burden because they start off just as a minor thing, but when you repeat it over time, hour after hour, day after day.
And then you throw in the aging process.
Yes.
Unfortunately, it can exacerbate things.
Another one, simple one, but this can make a big difference. I had my sister do this one. She sits a lot. She's working on the computer. Don't sit with your knees bent more than 90 degrees. You're really jamming that knee together the entire time. So we have her sit like this or even like this at times.
I've had usually younger people that have the thing of sitting like this.
Right.
That knee is really putting a lot of stress. It's not only end range, but it's rotated and twisted.
Yeah, that's a good way. If you want to hurt your knee, there you go.
Sit like that all the time.
All right,
get to it.
The next thing is you want to get some movement without resistance. And we're just trying to get the synovial fluid moving a little bit, a little more blood flow to it. So you can find a high bench like this or a high table, and you're just going to swing your legs back like this.
Yep.
Just you're getting some movement. There's no resistance. There's a little bit of traction.
I actually had, you remember Bev, she would do this with knee patients, and she'd put a little ankle weight around one of their ankles.
Oh, she would?
Just for a little distraction, and that would help pull the knee apart, and it'd just be relaxing like a pendulum.
Am I remembering you talked about a patient that did it on the end of his truck?
Yes.
Yeah, after knee replacement.
After he had a pickup truck. He'd fold it back, and he said that works really well. He would sit on the end of his pickup to get range of motion of a knee, and he was very, very happy with those results.
Now we're going to show you a little more of a commercial way to do this,
Right.
And this is our giveaway. It's called the Fit Glide. This is going to be very helpful after knee replacement because what's nice about this, not only are you going to work the knee that you had replaced, you're going to work the other knee. And most people, when they have one bad knee, they often have two bad knees. And this is a way to stay fit after the surgery even.
But
after
I highly recommend it doing prior to the surgery as prehab to get things maximally moving. And it simply goes like this. You sit and very little resistance, and you work this. And you do this for 2 to 5 minutes. I'm going to say 2 because initially you'll feel it after a couple of minutes, but it's not aggressive. There's not much weight going through the knees. It's ideal for it, and that's why we made it this way. One of the advantages is you can put it up so you have an incline.
And to me, that's a lot more comfortable on the ankles when you put it up.
Yep, that can be it. And right now we're working a little more quadricep. It can change the ankle range, like Bob said, so it can be more comfortable. We also can. Usually, I'll do this when they're getting a little bit stronger because this works the hamstrings,
right?
And it's much harder than it looks, even for a.
Now, I'm going to warn you. The one negative about this is not silent completely, Brad. You can hear a swish, 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 swish.
But it's not bad.
No, it's not bad. But I'm just saying there's some of those devices, and they're very expensive and heavy.
Right.
But they're silent.
Yep.
But show how light this thing is, Brad.
Yeah, I mean, you can one finger, and it's built very well. You can drop this thing. That is not even going to affect
I'm glad it didn't break. All right, I want to show Brad how you can use this in bed, by the way, too. So you want to bring it up and put some towels on there, would you please?
Yeah, this is a really unique feature of this. Easy to clean, too.
You going to put the towels on there, Brad?
Oh, sure. Well, you don't have to put towels on there.
No, you don't.
It's more comfortable.
Especially since I don't have shoes on.
Sure.
So, you got it all the way down?
No, Bob's a tall drink of water. Yeah. We got too short of a plinth here.
How's that?
Yep.
So, look at this. You can work this baby. I can run.
But yeah, and it's just.
So this is, if you got a patient that you have to go see in their room.
Yeah.
And they need to work out, you need to start getting some strengthening.
Yeah. So we're obviously referring to therapists.
Yeah, right.
Or any aid, health aid, a home health aid may be a perfect situation for
All right,
this.
just put in a quarter mile, Brad.
All right.
So the final thing we're going to show you is you can actually, if your knee is lacking, it's not completely straightening or it's not completely bending,
Ah, yes.
what we have found is that by stretching it to the full range of motion, it actually often decreases your pain levels.
Yep.
And it also gives the knee joint full motion to move. So it spreads out the forces, I think, so it's not as hard on the cartilage.
Yeah.
So you can do it with the knee glide. You can do some stretches, straightening.
So what we're going to do, instead of just push on it, we're going to actually do repetitions or some
Pressure on, pressure off, pressure on, pressure off. Yep. And this is something that you don't want to do just once a day. You want to do it throughout the day.
Right.
And we find out that, and if you don't have a knee or a fit glide, did I call it a knee glide or a fit glide? If you don't have a fit glide, you can take a stool and just sit on a regular chair, and I'm going to do pressure on, pressure off. I'm not pushing on the knee itself. I'm pushing right above the knee. Pressure on, pressure off.
It works nice if you have a stool with wheels on it, because it just rolls. It
works nice.
It's more fluid that way.
Now, little variations of this, you can sometimes turn it out like this and pressure on, pressure off. This is the one that worked for my wife. Turn it out.
Yep.
Or you can turn it in.